My guest is a regenerative leader aiming to foster unity in our shared desire to thrive and collaborate across sectors to promote sustainable and impactful progress and well-being. You're listening to the PHEC podcast, episode 410. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations, community health foundations, and government agencies. We specialize in a variety of community assessments, helping our clients to collect, analyze, manage, and communicate their health information in plain language to the communities they serve. The support we provide often falls in categories of strategic planning and sometimes capacity building, just depending on the needs that you have. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will also be provided in the show notes as well as the description for this episode. I'm really happy to introduce you to my guest on this episode. Let me formally introduce her, and then I'll connect our conversation. Allison Rapp is the president of the Florida Public Health Association. She joined the association in 2014 and the FPHA board as a member at large between 2018 and 2021. Allison was treasurer from 2021 to 2022 and was elected as second vice president for the 2022-2023 year. Now, the second vice president subsequently serves on the board as the first vice president, and then immediate past president for a 4-year term. Now, as vice president, Allison chaired the annual Education Conference Planning Committee and led the design of the agenda titled Public Health Unbound, Here, There, and Everywhere. She presented her vision for public health as Unbound, highlighting that public health is integrated into all issues, all sectors and areas of our lives in a variety of ways. As a regenerative leader, Allison has sought to foster unity in our shared desire to thrive and to collaborate across sectors to promote sustainable and impactful progress and well-being. Allison grew up in the suburbs of Boston as a pre-professional ballet dancer and moved to South Carolina to dance professionally upon graduating from high school. She began her undergraduate degree at the University of South Carolina and completed it at the University of Central Florida as a sports and fitness major. Returning to South Carolina, she completed her master's in public health and physical activity at USC's Arnold School of Public Health. She became a certified health education specialist in 2012 and a master's certified health education specialist in 2024. Her career began at the South Carolina Institute of Medicine and Public Health, followed by a final transition back to Florida for a position as Healthy Community Site Director for Special Olympics Florida. Subsequently, she joined the Health Council of West Central Florida as Special Projects Manager, where she led community assessments and planning. Most recently, Allison served as the National Program Office Coordinator for Fearless Public Health and Community Regenerative Leadership Initiative at the University of South Florida College of Public Health, Center for Leadership and Public Health Practice. Let's connect my conversation with Allison right now. Hi, Allison. Welcome to the podcast. How are you today?
I'm doing well. Thank you for having me.
Oh, my pleasure. I'm excited for our conversation. I know I say that all the time, but it is genuinely true. I'm really happy for our conversation. I have a lot of the questions I typically ask my guests, but I'm excited for how your responses will emerge and how that'll direct our conversation. So, why don't we start with you just sharing a little bit about yourself? Tell everybody who you are.
Sure. Well, I'm excited to have this conversation. I have been listening to your podcasts. I'm a runner and have been enjoying, especially over the last couple of days, last couple of runs, I should say. I am the president of the Florida Public Health Association, and my term is July 2024 through our conference in July 2025. And I have been a member since I moved to Florida. It was one of the first things that I did. I moved from South Carolina for a position here in Florida in June. And that year in July, I attended my first FPHA conference and have been a member ever since. I've served on the board in several different positions. And let's see, that's my current state of where I am.
I love the fact that, you were right here in my neck of the woods coming from South Carolina.
That's right. Yes.
That
Yes.
that that is awesome. I love that. Did you stay here very long? Were you here in Columbia very long?
Funny question. Originally, I moved to Columbia right after high school to dance with Columbia City Ballet and started my undergraduate degree at USC, Go Gamecocks, and met a boy and did what you tell any young woman, don't follow the boy. Well, I ignored that and I followed the boy to Florida. After he graduated, I transferred to University of Central Florida and finished my undergrad in sports and fitness. I married the boy. I am still married to the boy. And then we decided the economy tanked. I was a personal trainer after I finished my undergraduate degree. We decided to go back to South Carolina. And so we were there for another couple of years. I got my master's degree. I worked for the South Carolina Institute of Medicine and Public Health. And then we decided we wanted to move back to Florida. It was a whirlwind. We both got new jobs within 4 days of each other. We had a new baby at the time, and within 6 weeks, we were in a new house in a new state, and we've been here ever since.
Oh, what a cute story. Oh, my goodness. So I was thinking about when you said the ballet, one of the things I love is the production of the Nutcracker around the holidays. I would take, well, my husband was never really interested. He went one time, but my daughter would go all the time, and I would take my mother with me, and I turned it into a girls' trip, a girls' night out for the holidays. So we did it every year for a while, and then we went to like every other year, but that's one of my favorite things when you mentioned the ballet here in Columbia.
Oh, well, maybe you were there when I was
I know.
dancing. It was a very long time ago. It's funny. I have 2 boys and my husband, and I would love to take them to the ballet, but nobody wants to go with me. So it's been too long since I've seen the Nutcracker, but I have been in more performances than I could ever count on in the course of my lifetime. So.
Oh, that's so sweet. Well, thank you for taking that little rabbit trail with me. But it's rare that I get to chat with someone about something so local. And this part of South Carolina is very, very small and like hometown feeling. So it's kind of nice to have a little moment like that. So thank you for sharing that part of your journey. So I'm curious, when did you first learn about public health or first consider public health as a career?
I really love that question. And, growing up certainly as a pre-professional ballet dancer, physical activity I was always working. I always had a goal in mind. And around the age of 11, I was diagnosed with scoliosis. And I started wearing a back brace that I slept in. About a year later, I went in for, my annual x-rays, and the orthopedist that I saw at the time said he wanted to do spinal fusion surgery. That would have ended at around, 12 years old, my ballet career trajectory. So my parents decided, well, we're going to get a second opinion. We got a second opinion with one of the top doctors in the Boston area, which is where I grew up. And Dr. Lyle McKaylee, is my hero. He's now retired. He is the orthopedist for all of the sports teams in Boston. He's always at the Boston Marathon. And he took one look at my x-rays, one look at me, and pushed me back into place with his fingers. And he goes, "This girl's too flexible. Let's try a different kind of back brace and physical therapy." They were hoping to hold my curve where it was, around 40-something degrees. If anybody knows anything about scoliosis, it's right on the line of where they start to look at surgery. And the catch kind of was that I had to wear this back brace for 18 hours a day. I get to take it off for ballet, and I get to take it off for like a shower, and I was back on. So my parents went back to the previous doctor and said, "Okay, we're going to try this." And my dad said, "Why didn't you tell us about this as an option?" And he said, "Well, most of the kids don't wear their back braces. They just stuff them in the lockers at school. But, Allison might be okay with it." And she's pretty driven. About a year later, I went back after doing the physical therapy and the different kind of brace. And the curvature corrected about 20 degrees. So that I use as my, how did I get interested in public health? I don't think I really still knew what it was, but I knew prevention. And I knew that if I could prevent, I could do what I wanted to do. And I certainly was driven, and I wore that back brace. I hated that back brace, just like any other kid would. But I wore it, and it saved so much I look back, and where would I be now without that? I mean, there's so many different times in our lives we can look at that, but that's really where I began. The physical therapy, I loved my physical therapists, and they ended up asking me to do instructional videos and be their model for training. I got to participate in an annual back brace clinic for people learning how to make them. And all of that, I thought I wanted to go into physical therapy. I was fascinated by the human body, by the muscles, and how everything connects, and how, just something as small as a blister can go up your body, and it certainly does. And I spent one day shadowing a physical therapist in the hospital and realized clinical health was just not where I needed to be. And I have gone back to the idea of I love learning about the body. And so I take that with me into public health. And that's my story of beginning to understand it and internalize public health and prevention.
That's a great story, great connection. I love that because there's so many moments where we can connect public health to what we're doing. Your story of the scoliosis resonates with me. My daughter was diagnosed around that same time, and she also had to wear the brace. I can't remember the degree of her curve, but now you've got me to wanting to go back and look at, because I have all the documents and the x-rays. She's an adult now, but we did followed some of those same steps. She wore a brace. Our thought was, let's get her really interested in this brace because she's got to wear it. So we let her pick out the color and all. It was like a purple color and it had butterflies on it. It was just, but it was part of her routine, and she was, she's got to wear it. She needs to feel some kind of connection with it or kind of like it. But Yes, we went through that, a lot of those steps. So thank you for sharing that story and connecting it to public health from the perspective of prevention. That's really good to hear. What about now? Is there a particular population or public health condition or problem that you are most passionate about?
All of the above, yes. You know, my passions have evolved ever since, looking at physical therapy and knowing that I wanted to do something having to do with the body, having to do with health. And I kind of went from that into the sports and fitness area and into personal training, worked in a gym. I did not like working in a gym. And I realized that in a moment of, it was during the recession. And I had people coming to me who, personal training is not cheap. And as much as I needed to make a living at the time, they were coming to me and saying, look, Allison, I know this is really important, but they're going to turn the electricity off and I just can't pay for personal training anymore. Well, of course you can't. And, I still had the pressures of that. So there's my next look at understanding the world in public health terms, and realized at that point I needed to go to grad school in order to do what I wanted to do. And it was through that really my eyes were opened up to how broad public health is. And I approached graduate school initially with the idea of obesity prevention, which is still very important to me. But then I got into some projects around chronic diseases, and I was like, well, this is all connected to each other. One thing connects to another. And so it's just continued to evolve, I'd say. If my heart is somewhere right now, at this very moment, I would say that the things I love to do are the strategy and planning pieces. I like to do it through the eyes of systems change and looking at cross-sector coordination, cross-sector collaboration. I think the two are different. And the issue I'm most passionate about would be mental health access, treatment, and really more so neurodiversity. I've learned so much about what that means. My children are my best teachers. Not only have they taught me a lot about myself and their selves, but really a different lens to approach the rest of the world with. So that's my soapbox these days.
That's very important. It's not easy to narrow when you've got a lot of different areas that you're passionate about and to narrow it down. But I like a strategic approach. That's very much because I feel like you can do so much more from a strategic point of view, a perspective to touch on so many other areas too. So
That's
thank
just
you.
it.
Yeah,
Why not get more bang for our buck? We've got so
exactly.
much to do in this world, but in our world of public health, why not try and get more done at once?
Absolutely. And I feel like because our problems are that we look at are just can be so overwhelming. So we can be consumed by all of that. But if we are more strategic, then like you said, best bang for the buck. I definitely like that. Let's shift just a little bit, but not too much, because it's kind of a great segue into what you do. Because I know that you are a very prominent figure. You touched on, you're in your presidency with Florida Public Health. So let's talk a little bit more about Florida. So I have had guests on the podcast, and you may have been referring to the president of the American Public Health Association.
Yeah.
So she talked a lot about, from that federal level, and when I say federal level, the organization as it covers the whole country. And then I've had several folks that represent different areas of APHA, maybe from sections or so forth. But we're talking about, one of the affiliates, which we hear that from APHA. And so the affiliates are those state public health associations. And so you're in Florida, and I'm really would love to hear about just what is it like at Florida Public Health Association? We've got some obvious challenges across the board in public health, but how is Florida showing up? What are you doing? What are you leading? Are there any special initiatives? Just kind of chat with me about that.
I'm just thinking about where to start with my response. I have been here in Florida since 2014 and consistently since
Yeah.
2014. And what I love about the Florida Public Health Association is that it brings us all together because Florida, I would say, now I haven't had a lot of experience with a lot of states, but the issues on the Panhandle are different from the issues in Central Florida. And I mean, even so much in between. And, they say the further south you get, the further north you go. Or at least I've heard that somewhere. But it's such, even within the county I live in Hillsborough County, which is where the city of Tampa on one side. And then we have the strawberry fields of Plant City still within our county lines. And we're one of the largest counties. And you can't narrow it down, but you have to look at each individual community differently. And so I love when we can bring our colleagues together to look at what is happening in our world, in our country, in our state, and how can we work together? Right now, it's interesting to be in Florida, and we're watching the rest of the country kind of experience a lot of the changes that we've had over the last couple of years in Florida. And I think a lot of what our approach and our thoughts with the association and truly how I'm approaching public health with looking at it as public health is everything. Let's take a step back, look at everything we do, everyone we serve, because it is that diverse. And diversify ourselves in our membership. We're working very closely with all the colleges and universities because primarily for a long time, we've served, the majority of our members have been from the Department of Health, and we absolutely love to have that. And they bring so much of what our communities are doing and what the important issues are from one side of the state to the other. But if public health is truly everything, then we need everybody at the table. And so I was the chair of our annual conference last year, and we named our conference, or titled it, Public Health Unbound, Here, There, and Everywhere. And ever since the conference, I've taken that as for lack of better terms, my position on public health in Florida, my platform, that's what I was saying. And really trying to emphasize that public health is everything. It's this pen. It's this water bottle. I can't do my job without the pen. You can't learn without the pen. And when we look at the social determinants of health, or, there's a lot of different models, the vital conditions that we can look at, all of those things contribute to our collective ability to be healthy. And so let's look at where we can find the places that we can move forward together, even though we may all differ across our state. Let's look at where we can start with kind of the low-hanging fruit of what are we all after? Ultimately, I see public health, and I see that just people in general, we all want the same things out of life. We want health, happiness, love, prosperity. We just sometimes have different definitions of what that means and different ways of getting there. So let's think out of the box.
That's really well said. My oldest son lived in Florida for a while, actually in your county, lived right just outside of Tampa for years. He and his wife, and that's where my first grandson was born. And then they've since moved out of the state. But I spent a lot of time in Florida. We have a lot of events, but I got really familiar with, well, not to mention the obvious, Disney World, and I love Disney World. But I got really familiar with the state, and when you describe the differences in the Panhandle, and folks that are not as familiar with Florida, just look at the map and how it's shaped, and you've got like Tallahassee and Pensacola, two popular cities that are in the Panhandle region, and then you've got, like those coastal cities, St. Augustine and Daytona Beach, and then you've got Miami down at the bottom, and you've got, Orlando kind of in this, I'm not sure what Orlando's be considered, what part of the state it would be. It was like right in the middle kind of.
Central Florida, yep.
But there's so many, and those areas are so different. So you raise a good point about the need to bring those representatives from different parts of the state. So connecting with, the association, having members that are working at the health departments that are representing these different counties and different parts of the state will bring that representation together. So that's a great reminder. Some of us do that really well, and some of us maybe have to be thinking about it more proactively, making sure that we're bringing the different partners to the table. I've engaged in a few activities around the state, different events with stakeholders and members, and I even supported the conference last year through advertising. I was excited about that. And it was, really intentional on my behalf because there's only one state physically between, yours and mine, but we're all in the southeastern region, the South. So we have a lot of similarities, and I want to be viewed as a trusted partner and a collaborator in this work. So I intentionally inserted myself in a few events. I was invited and I accepted in one or two, but I really want to be able to partner and, be viewed as that trusted partner in this work that there's a lot of work for us to do and a lot of work to be done. And so that was by design a move that we made. But thank you for giving us kind of a view of the approach and that reminding us of how everything is public health. That's such an important reminder. I was thinking about that this morning, even as I was preparing for the day, and thinking about how we have these conversations with people. And I think in one way, because of everything that's happening, we can always be frustrated and justifiably frustrated. And there's times for us to have those frustrations voiced and be heard. And then I also thought about the opportunity to take all of these examples and share back to the people who don't quite understand public health and don't get it and don't think it's important, to keep bringing these examples back to them of why it is. These multiple little touch points and overlaps that people aren't thinking about, like when you held up that pen and you're talking about these things. So just an opportunity for us to keep standing up for public health, explaining, educating, advocating for public health.
I think there's a lot of confusion over what public health is, for those that are not in our everyday public health world.
Right.
I may be jumping forward to one of your other questions, but as I was preparing myself, I was thinking about just how would, people describe what I do. And it has been years since I've been a personal trainer, since I've taught anybody how to exercise. And a lot of people in my life, I think, still would say like, oh yeah, well, she teaches people exercise. My kids thought I worked in a hospital for a long time and that I was a doctor or a nurse. And I was like, no, bud. Nope. Only for you guys. Nope. But we are so much more, and public health is so much more than vaccines and seatbelts. And there's so much to public health. And I would argue everything. I'm open to the challenge. Can you find something that stumps me? Because it might not be a good connection, but I will connect it.
That is amazing. Thank you so much, Allison, for taking time and having this conversation with me and coming onto the podcast and sharing your views and thoughts and insights with our podcast listeners. I do appreciate that. I'm going to share with everyone in a moment how to connect with you. But as we kind of wrap up, I wanted to just take a moment to express my appreciation for what you do and encourage you to keep doing the good work and leading the charge in Florida.
Thank you so much. I'm honored to be here, and I really appreciate the opportunity. I love what I do. I love talking about it. So having the opportunity is very special and meaningful to me as well.
Well, I really hope you enjoyed that conversation as much as we did. I encourage you to connect with Allison and learn more about the work that she's doing. Be sure to let her know that you heard her on this episode. You can find the links to connect with her on the show notes page. Now, the show notes page for this episode, which is episode 410, can be found at phecpodcast.com. Once you're there, just navigate to episode 410 to find the show notes. Now, one more thing before you go. Remember that our podcast has a new app where we can continue the conversation from episodes like this one with public health professionals from around the world. We really are off to a great start and encourage you to join us. You can download the new PHEC Podcast Community app in Apple or Google Play Store. Just type in the search bar, PHEC Podcast Community, and it will pop right up. The links are also in the description for this episode on the show notes page. And then you can also just visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.